talk about ovarian cancer, endometrial cancer, osteoporosis risk for diabetes, and obesity. But I'm going to show you the data on breast cancer because it's so compelling to me. I never knew about this. So the first study that was ever published about breast cancer and a relationship to breastfeeding was published in The Lancet in 1977. Now, my colleagues, they like to stand around and complain about what people are saying and saying there's no evidence for that. They want studies to be published in very respected journals. The Lancet is probably one of the top 3 journals, so you can't, it's a very good study to get into The Lancet. This group of researchers went to Singapore, Hong Kong, and they studied breast cancer risk among the Tonka boat people. Does anybody know about them? It's a group that lives outside of Singapore and they fish. And their culture has always been fishing. They live on islands and in boats. And their culture forever and ever and ever is that they only breastfeed from the right breast. The women breastfeed only from one side. And we think it's because of the way they paddle their boats, we think. So the left breast is unused for years and years and years and years. And the study, well, that's a perfect study. That's a case control study on the same body. And the research showed that there was an increased incidence of breast cancer in the left unused breast. And that was the first study that ever showed this. So people like studies. So we now have a lot of studies, and I'm showing you some of the studies. But basically, the result of the study is shown in this box here. And if the result is under that bar, that means that there was a statistically significant difference found. And basically what the studies found was that every time the baby sips, the risk of the mother's breast cancer goes down. And there's a direct inverse relationship. This study from China looked at women who breastfed for 2 years, any number of babies, 24 months, and they decreased the risk of breast cancer by 50%. 50. So, is there a relationship in the United States that our breastfeeding rates are low and 1 out of 8 of our sisters are getting breast cancer? Absolutely. There absolutely is a direct relationship. We are now seeing this. It's one of the reasons for that. So there's a direct relationship to that. The data is very clear on this. Again, people like data. Here's the Lancet 2002. They did an evaluation of 47 studies from 30 countries looking at 150,000 women. They found, again, the same thing, that the relative risk of breast cancer decreased by 4.3% for every 12 months of breastfeeding. Also, we're here to talk about maternal health. We're here to talk about infant mortality. I've given you in this packet the article on infant mortality. So here, this article is Breastfeeding and the Risk of Postnatal Death in the United States. I actually had the ex-chairman of pediatrics at my department tell me that it had nothing to do with infant mortality. He said it can't. He said it can't. He said we have too many resources in our country. We have clean water. We have enough formula. We have clean bottles. He said there can't be an association with breastfeeding and infant mortality. I said, Joel, are you at all familiar with this study? So this is the study that was published, and their concluding remark is that promoting breastfeeding has the potential to save or delay about 720 postneonatal deaths in the United States. So this study looked at babies out of the 1 month period, so deaths from 1 month to 12 months, just looking at breastfeeding as a variable, and they found that we could have saved 720 U.S. babies if they had been breastfed. And you can look for their definition of breastfeeding. And then what about money? Does this have anything to do with money? Could we save money if we had babies breastfeeding and meeting Healthy People 210 goals? So this study was published. It's quoted in here. If we were to be able to increase the number of children that were breastfeeding in the early postpartum period, going from a rate of 64% in 2000 to this goal of 75%, just 1 sip counts, to meet Healthy People 10 goal, which you know about now, we would save $3.6 billion in healthcare costs.